Insights into lung cancer, types, treatments, and prognosis. Lung cancer, one of the most prevalent forms of cancer, arises when carcinogens, often found in cigarette smoke, instigate the aberrant growth of cells within the lung. This uncontrolled multiplication results in the formation of tumors, causing destruction of adjacent lung tissues. Subsequently, these tumors may metastasize to various regions, including the liver, bones, adrenal glands, and even the brain. While cigarette smoke remains a primary culprit, it is noteworthy that an increasing number of lung cancer cases are being diagnosed in non-smokers, although this constitutes a minority of new occurrences. Categorization of lung cancers. Lung cancers are broadly classified into non-small cell lung cancer, NSCLC, and small cell lung cancer, SCLC, each displaying distinct cellular characteristics under microscopic examination. The crucial factor in determining treatment approaches lies in identifying whether the cancer is localized or has metastasized, influencing the efficacy of interventions. Non-small cell lung cancer, NSCLC, constituting approximately 85% of all lung cancers, exhibits varied subtypes based on microscopic features. Non-small cell lung cancer, NSCLC, a closer look. NSCLC constitutes a majority, approximately 85%, of all diagnosed lung cancers, distinguished from small cell lung cancer, SCLC. By its cellular characteristics under microscopic examination, NSCLC encompasses several subtypes, each presenting unique features and considerations in terms of prognosis and treatment. Subtypes of NSCLC. Adenocarcinoma. Prevalence. Adenocarcinoma stands as the most common type of NSCLC. Demographics. Intriguingly, it is not solely associated with smoking, being the predominant lung cancer type in non-smokers and individuals under 45. Location. Typically, adenocarcinomas develop near the lung's periphery and may involve the pleura, the membrane covering the lung. Squamous cell carcinoma. Formation. This type often manifests as masses near the center of the lungs. Progression. As the mass enlarges, it may protrude into larger air passages, bronchi, and in certain instances, create cavities within the lung. Large cell carcinoma. Location. Similar to adenocarcinoma, large cell carcinoma tends to emerge at the lung's periphery and may spread to the pleura. Cavity formation. Like squamous cell carcinoma, it has the potential to form cavities within the lungs. Adenosquamous carcinoma, undifferentiated carcinoma, and bronchiolo-alveolar carcinoma. Rarity. These subtypes are relatively rare within the spectrum of NSCLC. Prognosis. Adenosquamous carcinoma is noted for having a less favorable prognosis compared to adenocarcinoma or squamous cell carcinoma. Treatment considerations. Surgery. Applicability. Surgery is a primary treatment for localized NSCLC that is not spread beyond the chest. Types. Surgical interventions range from wedge resection, removing a small part of the lung, to lobectomy, removing one lobe of the lung, and pneumonectomy, removing an entire lung. Lymph node examination. Lymph nodes are routinely removed and examined to determine if the cancer has spread. Video-assisted thoracoscopy, VATS. Minimally invasive. Some surgeons employ VATS to remove small, early-stage tumors, particularly if they are located near the outer edge of the lung. VATS, involving small incisions, is less invasive than traditional open procedures. Genetic testing. Mutation evaluation. Genetic testing of the tumor is integral to identifying specific mutations that drive cancer growth. In cases where mutations are present, targeted therapies are increasingly becoming viable treatment options, showcasing promising results. Chemotherapy and radiation therapy. Complementary approaches. Depending on the extent of tumor spread, chemotherapy and radiation therapy may be administered before and or after surgery. While NSCLC often exhibits poor responsiveness to chemotherapy, advanced genetic testing can aid in predicting favorable responses to specific treatments. Prognostic considerations. Localized recurrence. Post-surgery challenges, notably, even when NSCLC is believed to be localized and treated with surgery, there is a risk of recurrence, either at the original site or in other parts of the body. This suggests that cancer cells might have started spreading before detection. Advanced testing. Predictive power. Sophisticated genetic tests have emerged as valuable tools, enabling the prediction of patient responses to various treatments, including chemotherapy and newly developed targeted therapies. Small cell lung cancer, SCLC. Small cell lung cancer, SCLC, represents a distinct subtype of lung cancer, comprising approximately 15% of all diagnosed cases. Distinguished by its rapid growth and high metastatic potential, SCLC poses unique challenges in terms of diagnosis and treatment. Here, we delve into the key aspects of this aggressive form of lung cancer. Diagnosis and characteristics. Early metastasis. SCLC is often diagnosed at an advanced stage, with a propensity for early metastasis. This characteristic limits the feasibility of surgical intervention as a primary treatment option. Microscopic appearance. Microscopically, SCLC cells are small in size and exhibit a distinctive appearance, forming clusters with scant cytoplasm. This histological pattern aids pathologists in differentiating SCLC from other lung cancer types. Staging of small cell lung cancer. Limited stage. In the limited stage, SCLC is confined to one lung and adjacent lymph nodes. This stage allows for a more localized treatment approach, incorporating combinations of chemotherapy, radiation therapy, and, in rare instances, surgery. Extensive stage. The extensive stage signifies the spread of cancer beyond the confines of a single lung and its nearby lymph nodes. Treatment strategies for extensive stage SCLC primarily involve systemic therapies like chemotherapy and, if necessary, radiation treatments targeting metastases in the brain, spine, or other bones. Treatment modalities. Chemotherapy. Chemotherapy forms the cornerstone of SCLC treatment, showcasing efficacy in reducing tumor size and controlling metastatic spread. Due to the high likelihood of microscopic disease dissemination, even in apparently localized cases, systemic treatment is crucial. Radiation therapy. Radiation therapy plays a pivotal role, particularly in addressing symptoms caused by metastases. It can alleviate pain and discomfort associated with bone metastases and may be employed to manage intrathoracic disease. Surgery in limited stage. While surgery is rarely employed in SCLC, exceptions exist in the limited stage, where selected cases may benefit from surgical resection, usually in combination with chemotherapy and radiation therapy. Challenges and prognosis. Aggressive nature. SCLC's aggressive growth and tendency to metastasize quickly contribute to its overall challenging management. This rapid progression necessitates prompt and comprehensive treatment strategies. Prognostic considerations. The prognosis for SCLC remains guarded, particularly in extensive stage cases where curative outcomes are less common. Despite the initial responsiveness of SCLC to chemotherapy, recurrence is common, underscoring the need for ongoing research to refine therapeutic approaches. Brain radiation and memory considerations. Preventive brain radiation. Given the propensity of SCLC to metastasize to the brain, even in the absence of apparent symptoms, preventive brain radiation is often considered. However, this decision must be weighed carefully due to potential side effects, including memory loss. Memory function after radiation. Patients undergoing brain radiation, with or without chemotherapy, may experience a decline in memory function. Balancing the potential benefits against these cognitive effects becomes a crucial aspect of the treatment decision-making process. Risk factors. Several factors heighten the risk of developing lung cancer, outlining a complex interplay between environmental exposures and individual behaviors. Smoking. Dominant risk. Smoking stands as the primary risk factor, with cigarette smokers facing a staggering 13-fold higher likelihood of developing lung cancer compared to non-smokers. Second-hand smoke. Inhalation risks. Non-smokers exposed to second-hand smoke from cigarettes, cigars, or pipes also confront an increased risk of lung cancer. Radon exposure. Invisible threat. Radon, a colorless and odorless radioactive gas, emerges as the second leading cause of lung cancer. Its impact is particularly pronounced in smokers and those exposed to it in occupational settings. Asbestos exposure. Occupational hazard. Individuals exposed to asbestos, especially in the workplace, bear a heightened risk of lung cancer. This risk is further compounded in individuals who smoke. Occupational exposure to carcinogens. Workplace risks. Occupational contact with carcinogens such as uranium, arsenic, vinyl chloride, and other agents significantly contributes to the overall risk of developing lung cancer. Symptoms. Lung cancer, a stealthy adversary, often reveals its presence through a constellation of symptoms that warrant attention and prompt medical evaluation. Persistent cough. A lingering, persistent cough, especially if it lasts for an extended period, can be an early indicator of lung cancer. Coughing up blood. Hemoptysis, or coughing up blood, is a concerning symptom that necessitates immediate medical attention. It can range from streaks of blood in phlegm to more severe bleeding. Wheezing. Unexplained or persistent wheezing, a high-pitched whistling sound while breathing, may signify airway obstruction or inflammation. Shortness of breath. Breathlessness or shortness of breath, unrelated to exertion or pre-existing conditions, can be an alarming sign of compromised lung function. Chest pain. Persistent chest pain, particularly if it intensifies during breathing or coughing, may indicate involvement of the chest wall or pleura. Fever. While fever is a nonspecific symptom, its presence, especially in conjunction with other respiratory symptoms, may signal an underlying issue. Weight loss. Unexplained weight loss, often accompanied by a loss of appetite, can be indicative of a systemic disturbance, including certain cancers. Chemical changes in small cell lung cancer. Small cell lung cancers may exert additional effects, including chemical changes that alter sodium and calcium levels in the body. These changes can serve as diagnostic indicators. Diagnosis. Lung cancer diagnosis involves a meticulous process integrating clinical history, imaging studies, and invasive procedures to ascertain the likelihood of cancer and its specific characteristics. Clinical evaluation. Physicians initiate the diagnostic journey by evaluating symptoms, considering the patient's smoking history, and assessing potential environmental exposures. This comprehensive approach helps gauge the likelihood of lung cancer. Imaging techniques. Chest X-rays, often the initial imaging step, chest X-rays provide a broad overview of lung health, revealing abnormalities that may warrant further investigation. CT scans, computed tomography, a more detailed imaging modality. CT scans offer a comprehensive view of the lungs, assisting in the identification and characterization of abnormalities. MRI scans, magnetic resonance imaging, employed in specific cases. MRI scans provide detailed images without radiation, aiding in further characterization. PET scans, positron emission tomography. PET scans focus on metabolic activity, highlighting areas with increased cell activity, potentially indicating cancerous growth. Invasive diagnostic measures. Biopsies, essential for definitive diagnosis. Biopsies involve the removal of a small tissue sample for laboratory analysis. This can be achieved through various methods, including needle biopsies and surgical biopsies. Bronchoscopies, a thin, flexible tube with a camera is inserted through the airways to visually inspect the lungs and obtain tissue samples. Mediastinoscopies, invasive procedures involving the examination of lymph nodes or masses in the mediastinum. Crucial for determining the type and extent of lung cancer. Fine needle aspirations. Using a thin needle guided by imaging, a small tissue sample is collected for examination. Thoracentesis. If fluid accumulates in the chest, a needle is used to withdraw a sample for analysis. Video-assisted thoracoscopic surgery, VATS, minimally invasive surgery employing a small camera and surgical tools inserted through small incisions to visualize and obtain tissue samples. Staging of lung cancer. Non-small cell lung cancer, NSCLC. Localized, stage I, tumor confined to the lung without spread. Regional, stage 2-3, involvement of nearby tissues or lymph nodes. Extensive spread, stage 4, cancer has metastasized beyond the lungs. Small cell lung cancer, SCLC. Limited stage, confined to one lung and nearby lymph nodes. Extensive stage, cancer has spread extensively, involving distant organs. Expected duration and prevention. Lung cancer, left unchecked, follows an aggressive trajectory, underscoring the critical importance of prevention strategies and early intervention. Expected duration. Untreated, lung cancer persists and progresses, infiltrating surrounding tissues, and potentially metastasizing to distant organs. The duration varies, and the disease can advance rapidly, underlining the urgency of timely detection and treatment. Prevention strategies. Proactive measures play a pivotal role in mitigating lung cancer risk. Smoking cessation. Primary focus. Given that smoking is the leading risk factor, quitting smoking is a fundamental step in reducing the risk of lung cancer. Avoidance of secondhand smoke. Smoke-free environments. Choosing smoke-free spaces, including restaurants and hotels, and encouraging guests to smoke outdoors, particularly crucial in households with children, helps minimize exposure. Radon exposure reduction. Home testing. Regular testing for radon gas in homes and workplaces is imperative. Elevated radon levels contribute to lung cancer risk, particularly for smokers. Minimizing asbestos exposure. Occupational safety. Individuals in occupations prone to asbestos exposure, such as miners and construction workers, must adhere to safety measures. Additionally, addressing deteriorating asbestos-containing materials in buildings is vital. Lung cancer screening. High-risk individuals. The U.S. Preventive Services Task Force recommends annual lung cancer screening, particularly for high-risk individuals. Eligibility criteria include a specific smoking history and being healthy enough for potential surgical interventions. Treatment approaches. Navigating the therapeutic landscape. Non-small cell lung cancer, NSCLC. Surgery. A cornerstone in NSCLC treatment, surgery aims to remove cancerous tissue. Options include wedge resection, removing a small part, lobectomy, removing a lobe, and pneumonectomy, removing an entire lung. Genetic testing. Identifying mutations through genetic testing informs targeted therapies, optimizing treatment effectiveness. Chemotherapy, radiation therapy, and immunotherapy, depending on the extent of tumor spread. These modalities may be employed individually or in combination to combat cancer cells and enhance patient outcomes. Small cell lung cancer, SCLC. Limited stage, treatment involves combinations of chemotherapy and radiation, with surgery being a rare consideration. Extensive stage, comprehensive approaches using chemotherapy, potentially coupled with radiation to specific sites, constitute the primary treatment strategy. Conclusion. Lung cancer, a formidable foe, necessitates a comprehensive strategy encompassing prevention, early detection, and advanced treatment. The intricate interplay of risk factors underscores the importance of a nuanced understanding. Categorization and precision. Lung cancers, divided into NSCLC and SCLC, demand precise diagnosis for tailored interventions. Advances in imaging and invasive procedures enhance our ability to navigate the unique characteristics of each case. NSCLC and SCLC. NSCLC, the majority, requires varied approaches, surgery, genetic testing, and targeted therapies. SCLC, though a minority, presents challenges, predominantly addressed through chemotherapy and radiation. Prevention and early intervention. Proactive prevention, emphasizing smoking cessation and screenings, is pivotal. Early intervention, guided by advanced diagnostics, is key to curbing the relentless progression of the disease. Hope amid challenges. Despite lung cancer's aggressiveness, hope emerges through genetic testing and ongoing research. Balancing treatment rigors with cognitive aspects becomes integral. Partnership in progress. The fight against lung cancer is a collaborative endeavor, uniting professionals and individuals. Advances in science and prevention efforts contribute to redefining the landscape of lung cancer. In conclusion, the battle against lung cancer is multifaceted, requiring vigilance, innovation, and a united front. Each advancement contributes to the collective effort to diminish the shadows cast by lung cancer and instill hope in those affected. Your health matters. Quali.health